Hello. We'll continue with our examples on pharmacology and then one or two examples on surgery. But this time it will be now a quick way, and we'll not go in all details and creating UML and mind maps and all that. Just simple questions that as if before prescribing medicines, this is how a doctor thinks based on the patient's history, that what are common side effects of chloroquine which I'm prescribing, and how do they occur, so that whether based on that and based on the patient, two things doctor decides. Now here it is giving side effects of chloroquine. Chloroquine is almost what you say is indispensable medicine if malaria occurs, and malaria is still a big cause of death and illness in developing countries. So chloroquine has to be given, there is no other alternative. But it creates these gastrointestinal effects and this dermatological effects and ocular effect, vision, that is central nervous system effect, a cardiovascular effect, hematological effect, and so on. Okay, fine. Now, another question. A doctor is trying to prescribe azithromycin, which is another well-known medicine, azithral. But patient may be already taking some other medications, or he may be having other diseases, or he may be having alcoholism or something. So he doctor considers before prescribing this thing, that what are the factors which influence the effectiveness of azithromycin, and this is how. These are the factors: microbial sensitivity and dosage and treatment regime, and patient's compliance and drug interactions, and patient factors, that is age, etc., of patient, weight, gender, bacterial resistance. Sometimes azithromycin will simply not work because the type of the bacteria by which the patient is affected is already resistant to that drug. So a higher level antibiotic must be given, like that. Okay. Now sometimes this is required by a patient, or by, say, doctor has given him that he should take brufen and is having ordinary back pain. I again warn that in healthcare there is nothing ordinary, and you should not take anything without consulting doctor. But still, uh, suppose there is a 70 kg weight, and this is the height of the patient, and this is the age, he is a healthy male, he is not taking any other medication, he is a teetotaler. So that means no other alcohol or tobacco or anything, is a non-smoker. So we are complete, or nothing, no bad habits, and perfectly healthy. I'm trying to make my prompt safe, so that uh, I mean, I know that there are people who are tempted to mimic the answers. You should never do that in matters of health. Based on the weight, because many medications, if you see their dosage information in books, then it is given this many milligram per kg of weight. So it is possible that for a 50 kg person, something, some pill is actually overdose, and for a 110 kg person, the same dosage may not be adequate to give him total relief. Okay. I think ChatGPT is also tired. Actually, this is the last lecture, but sometimes the server actually comes busy. Let us wait for some time. Okay, let me try to refresh the page. No, the server has an error. Okay, I am saying regenerate the response. Yes, this time It again says I am not a doctor, but typically the recommended adult dosage of Brufen is for mild to moderate pain is 200 milligram every 4 to 6 hours, and maximum dosage is 1200 milligram or up to 3200 milligram, but that is only under medical supervision. Okay, it is important to note that exceeding the dosage can cause the risk of side effect. Now it is coming to my particular case, that your weight, height, and health status. I think you should start with 200 to 400 milligram and repeat the dosage every 4 to 6 hours. Again, it is clarifying that it is crucial that you contact your healthcare provider before following this. Is a response. It is continuously asking for feedback, so it goes on further refining its knowledge corpus. For example, in one example, we had added one huge blog information. So now onwards, when anybody asks similar question, it will automatically consider the information that I had provided from that blog, because I had said that this is information from authentic blog. Okay, so that is how it is a learning model. Now, this time I complicate the cases slightly. Previous one was a healthy person. Now I have borderline type 2 diabetes. Weight is also slightly on higher side, 80 kg. Height is 5 feet 8 inch, from which it can calculate BMR. And age is also a higher side, 51. Suffering from insomnia and taking 81 as a drug. So please consider any cross reaction before answering. Again, it will clarify I am not a doctor, and metformin dosage can vary depending upon various factors: blood glucose level, kidney function, individual response, and so on. But typically, starting the dosage for adult is 500 milligram to 850 milligram. Okay, and the maximum recommended daily dosage is 2000 to 2550 milligram. So it gives information. You can at least cross check. Sometimes you talk with your doctor on telephone and you are not sure whether you heard it properly or not. At that time, these things are useful. Then this I am leaving as exercise. How much antihistamine should I take for allergy? And last is surgery, of which we are often quite I mean, afraid. And surgeons seem to be the only people who would be completely, not rather completely. There also robotic surgery can be there, which can be powered by AI, but far still that would be both an issue of ethics, permissions, and expertise of technology. So, but this is just for general knowledge kind, that I am asked by my doctor to remove my tonsils, but I am a little bit nervous about what exactly is this tonsillectomy, and whether what are the risks, will it die in the operation, and will I die, or and what are the benefits? Means I have to weigh the potential risks and benefits before taking decision, because a true doctor never takes decision on your behalf. He just advises and then asks you that whether you want to go for the surgery or not. So here it is explaining that this is the procedure. You will have to take anesthesia. Okay, general anesthesia it is. So pain will not be there. Then this is how the doctor will access the tonsil using scalpel or laser. Then he will remove the tonsil. Some bleeding will occur, but he will try to minimize the bleeding. He will close the wound. Recovery will take this much time, and typically discharged on the same day. These are the risks. Every surgical procedure has its risk, and these are the benefits. Okay. So at least as a patient, one can get the knowledge, or think about a surgeon who is too busy and too bored also sometimes to explain the same things to repeated number of patients. Instead of that, he can keep a medical assistant who will follow this kind of tools like ChatGPT, or maybe more specialized tools with more accurate information, and explain and calm down the patient before he reaches the actual surgeon. So then the experienced surgeon's time, which is often very precious, is saved. Okay. Now here, now here it is given that what is the procedure for knee replacement and what are the risks and benefits. And knee replacement is also nowadays becoming a big common surgery in India and in many countries, because people are getting overweight and physical activity is reducing, and diabetes is one culprit, and our habits are sitting for long hours on chair. So this knee replacement is often advised. Then before again going for the procedure, the patient can read all this, that this is how it is done, and these are the risk factors and these are the benefits. And there may be some tool, just like we used plant UML, there may be some tool in which if this procedure part is fed into, it might create a live animation showing a video to the patient, so that patient becomes extremely clear about what he is going for. Okay. I don't know any such tool at present, but somebody might have already made, because AI space is exploding like anything. Or somebody can get inspired by watching this video. Thank you.